Okay, so hopefully everybody can see this handout. And I talked about this yesterday, but um, understanding the basics because we had done circulation. So this will be another question on the test is going through pulmonary circulation, what we're looking at. So um, whenever blood has come from the body somewhere, any organ, any body part, it's going to be high in CO2. Excuse me. You measure the concentration, high CO2, it's low in oxygen because it just gave oxygen to the tissues. Um, when the blood has left the lungs and it comes back to the heart, it is now high in oxygen and it is low in CO2 because it just gave the CO2 to the lungs so that the lungs could exhale the CO2. And then the gas exchange, where it trades, is at the capillary level. It never gives, whenever it has an artery or an arteriole or a vein or a venule, those areas are never diffusing because they are too thick. So it has to wait till it gets all the way down to a capillary. And that is where we diffuse the gases, carbon and oxygen, or carbon dioxide and oxygen, which is abbreviated. You need to know the abbreviation CO2 and O2. And remember, they want to equal their parts. So when they get to the lungs, okay, the lungs at that alveolus, remember that alveolus during inhalation is high in oxygen because the animal just took a breath. And the capillary underneath is high in CO2. So by nature, things want to move from a high concentration to a low concentration, same here to here, so they trade. So now, when the blood leaves the capillary, leaves the alveolus, as soon as it goes, that capillary now becomes oxygenated and it's high in oxygen and it's low in CO2. And then the alveolus, right after that, now is in high in CO2 and the animal exhales and it keeps repeating itself. So that is what's happening. And the opposite happens in the body. When it gets to the capillaries, say in the kidney, after it goes renal artery, renal arterial, renal capillary, the renal capillaries are high in, it was high in oxygen, and inside the tissues, it's high in CO2. So what happens is oxygen goes in the tissues, CO2 leaves the tissues. Then when the blood leaves the kidney, it is high in CO2, low in oxygen. So it's really, the diffusion is the opposite in each part. So on the test and on, your blood flow, you have the CO2 for O2, which means this is higher first, and then O2 for CO2. Now I have a tip. Now you guys have a handout. All my students have had handouts. And I do this for 3 tests. And so I had a student and she literally wrote down all these parts down here on index cards and shuffled them. And then she tried to lay them out on her table in order. So she tried, or I said, you could put it on sticky notes on like a window or a board or a wall and try to put them in the proper order. Really, that's how I think you could help you study. You could literally just try to write them out. You can even cut index cards in half and save them. But I think that's one way. People also have used, that lived in the dorms, have used expo markers on the windows, on your like sliding glass windows, is you can erase that and you could write out. So they used to practice writing out the flow. So these are just tips that students have told me in the past that have helped them learn this. But what we start with, and I personally, it doesn't matter where you start. On the test, there's going to be all of these words, obviously not in order. So you need to pick a place to start and put them in this order. Just the words, no explanations. And then you always have to end with wherever you started. So aorta, artery, arterial, capillary. Oxygen is given, CO2 is picked up, so O2 for CO2. Venule vein, vena cava. So remember, it goes big to little, little to big. Comes into the right atrium, goes through the tricuspid to the right ventricle, after the right ventricle, it goes out the pulmonary valve to the pulmonary artery. Now, this is where it's different from the last test. Then it goes, and you have to say pulmonary. You can't just say arterial. So now it's a pulmonary artery, pulmonary arterial, pulmonary capillary. And I have written here at the alveolus because that's where it's happening. The capillary is going to be around one of those individual spots. CO2 for O2. So they're going to give carbon dioxide to the lungs. They're going to pick up oxygen. It's going to go to a pulmonary venule, pulmonary vein, which empties into the left atrium, goes through the mitral valve, left ventricle, aortic valve, aorta. Now, where some people on the last test, at this point, they put aorta, and some people put body, oxygen for CO2. Well, the aorta has to subdivide. The aorta is extremely large, so it's going to have to be a series of divisions, just like going on a series of a big highway, getting off the highway, pulling into your neighborhood, pulling into your driveway. You're going into a series of smaller roads. Once you get home, you diffuse out of your car, somebody goes back in the car, and you're going to go from your driveway to your neighborhood, to the main road, to the exit, to the highway. So you see, if you're going home and going back, it's a similar flow. But remember, in the lungs, you have to say pulmonary. So that is what's different this time. Does anybody want to ask a question about what is happening with this flow? Everybody knows where I'm talking about. And this is what I want to see. Now we start digestive system next, and we will add, instead of this just saying capillary, we'll talk about how it flows to the intestines. And we'll do it one more time. Okay, so again, here's a little tip. Write it out, cover this up, maybe write all these words and mix them up on a piece of paper, and try to write it out from memory, and then pull this handout out and say, can you do this from memory? So just a thought. Okay, so, okay, this is where, there we go. All right, so let's look at the study guide. And let me go ahead and pull up the PowerPoint, so in case there's any questions about the PowerPoint. So, actually I need to get my study guide out so I have the questions. Okay, so the definition of respiration, so our basic review is basically the process of bringing oxygen to all cells in the body. So it's not just inhaling air. You got to bring all of that to the cells and provide carbon dioxide a way to leave in the opposite direction, because carbon dioxide is a byproduct of cellular metabolism, and it's a toxic metabolite. If you don't get rid of CO2, the animal is going to get very, very sick as CO2 builds up. Okay, so now that is the primary job of the respiratory system, but any of these others are, it says, what are secondary functions of the respiratory system? So remember, the voice production, body temperature regulation, the ability to pant is very important to regulate body temperature, to maintain the acid-base balance, which is basically our pH. So acid-base is, you know, the pH of our blood. If you're in a state of acidosis, if you have too much acidic content to your blood, then that's going to interfere with normal cellular function, could lead to cellular death. So the respiratory system, there's a lot of body systems that help maintain acid base, but the respiratory system is one of those systems. And then obviously sense of smell. So those are all functions. Now, we talked about what is the voice box, but we call it the larynx in animals. And remember, my little clue was larynx, lyric. So the larynx is the opening to the trachea, and basically the vocal folds or the vocal cords that are right there will vibrate with air, and that's what produces the sound. But that structure, the larynx is made up of different parts. So the larynx is like a structure, and if you took it apart, you'd have all the different parts. But it's basically for voice production. And how do they regulate temperature with respiration? By panting, but the superficial blood vessels here can vasodilate or constrict. They can increase evaporation of body water. That releases warm water from the body that will help cool the animal. Also, I always tend to focus more on panting and cooling off the animal, but it will also warm and humidify air coming in. If it's a cold day and the animal is inhaling cold air, it's going to actually warm that air as it comes in. So it can do both. Again, the body's trying to stay in hemostasis, and we got to move one way or the other, either cool off things, warm things up. Now for number 5, how does CO2 in the blood influence respiratory rate? Now, I've told you that the body doesn't like a CO2 above 40. So hopefully in my little email yesterday, I wrote down normal pH is 7.4 and normal CO2 is 40. As long as you're in that range of 40 and 7.4, then we should be in hemostasis. But what will happen is if CO2 is going up, then the animal is going to try to increase the respiratory rate and respiratory depth. And you need, or depth, not death, sorry. So you need to understand the relationship between CO2 and respiratory rate. In a normal awake animal, and it's like I talked about you guys in sighing. If you were sitting there like watching a movie, you're in class, you're chilling. If you think about how shallow you're breathing, you're not breathing very deep. And then all of a sudden you go, and the deeper you breathe, the more you expand your lungs, the more you're going to exhale. You're going to exhale more CO2. So the remedy to treat high CO2 is ventilation. And so the brain can trigger a breath, and they may make the rate go faster, and they may make the rate go deeper. Okay. So that is the relationship between that. Now, as I talk about later, remember when CO2 goes up, pH is going down. Okay. So they move together. As the CO2 goes up and the pH goes down, if the animal brings the CO2 back to normal, the pH will regulate. So they always move together. But everybody needs to know what happens. And the remedy, I'm literally doing monitoring in my other class for anesthesia right now. And if I have an animal that has a really crappy CO2, it's really high, I ventilate them more during anesthesia. I squeeze the bag more. And then I can see on my monitor, I see the CO2 come down, and then I back off. Because the opposite happens. If CO2 was too low, they're going to slow down rate and depth because it wants to bring it back up. The less you breathe, the less deep you breathe, the higher your CO2. So if anybody doesn't understand that, raise a hand, type a question, but you need to understand that relationship. The structures of the upper and lower respiratory tract. So basically, anything outside the lungs is upper respiratory. So that would be the trachea. That would be the bifurcation of the trachea. Okay. Once the trachea bifurcates, and then it's going to go into the lungs, anything inside of the lungs is considered lower respiratory. So that's how you divide them. So this slide is important. Well, first of all, this is the picture that you'll have to identify structures. It will be labeled. There may be questions about this picture, but these are all the structures of the upper respiratory tract. Okay. So we need to understand those. The lower respiratory tract, the lungs, the bronchus, the bronchi, the bronchioles, the alveolar sacs, and the alveolus. Okay, the capillaries are a cardiovascular structure. They're not a respiratory structure, but the alveolus is in that lower airway. For 8, the most rostral end of the respiratory tract, the most rostral end is the nares. It's the first spot. So it's rostral means nose, but the most rostral end is the nares, first place that air comes in, and we typically call them nares. So for number 9, it would be nares. We don't call them nostrils. Now this one, I always get questions in class. Let me mention, since I'm on this picture, remember the turbinates are the swirled bones in the nose, the air passages where air moves. The only landmark that I wanted you to know as far as the nasal passages is the ventral nasal meatus. Does anybody remember why I wanted you to know that? Why is that particular landmark important? So, well, air comes in all 3 places. Yes, for feeding tube, right. So if you have to pass, because air will come in all 3 of these, but if you had to pass, if you look at this image, and it looks like those lines are all covering it, but you can pass a feeding tube down through the nasal meatus, the ventral meatus, and it'll slide in the back of the throat and go down the esophagus. One of the earlier emails, I sent you guys a video of them passing a tube in a dog. It's a Bernese Mountain Dog, and they're passing a nasogastric tube. And so you see her numb the nose, and it shows a good view of passing that tube. So I thought that might help you. So understand, I did not have a question about that on the study guide, but I did want you to know that as well. And then for 10, okay. Oh, and remember the lining is the pseudostratified columnar epithelia, and it is ciliated. The job of the cilia and the mucus that it produces is to protect trapped debris during inhaling, hopefully would elicit a sneeze. And the same lining exists in the trachea. Now, this question I realized was vague on the study guide. I had somebody email me, and usually in class, someone's always like, can you answer this? Because it's not really in the book, but I brought it up. It says, what is housed in the maxillary sinus? The roots of this premolar right here. So those roots communicate with the maxillary sinus. And so that's what I was looking for, the 3rd and 4th premolar. It's also called the carnasal tooth. And so remember, if it gets an infection, I also showed pictures, they have a little wound. It's because infection gets trapped in the sinus, the abscess ruptures, and then they have like a painful, because these are air pockets within the skull. They do communicate to the back of the throat, but the problem is they're very small and they don't stretch a lot. So if they do get an abscess in a sinus, it can become painful, and we have to treat that. What is the pharynx and what is located in this area? It is the back of the throat. So, and remember my little thing, pharynx, food first. Showing the maxillary sinus. So not the frontal sinus, this sinus here. The roots communicate with, when I mean they communicate, they're not completely up there, but there's a little tip of the root of that tooth that pokes into that sinus. So if they get an infection in the tooth, the infection can migrate up into that sinus and then can potentially cause that tooth root abscess, sometimes called the carnasal tooth abscess. So your dog gets a little wound up here, and it looks swollen, and sometimes it makes their eye get smooshy. That's a very technical smooshy term. A lot of times it's because of the pressure of that sinus. So the pharynx is the back of the throat, it comes first, and it's the common passageway for food and air. That's why I say pharynx, food first. Comes before the larynx, passageway for food. Now it is divided. I didn't ask the specific question, but you need to know nasopharynx, oropharynx, because it is divided by the soft palate, not the hard palate. The hard palate is up here, okay? That's the roof of the mouth. If I go back in the throat, then, you know, like have the softer structure be caudal to the hard palate as the soft palate, but it basically divides the mouth, the opening here, from the airway passages. So air is moving here, comes down into the larynx. When they eat and drink, it comes through the oropharynx and slides over into the esophagus. And the esophagus is dorsal to the trachea. That's why there's these little bumps here. Bump, 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 bump. Okay. What is contained in the larynx? What are the arytenoid cartilages? Basically, the epiglottis, the arytenoid cartilages, and the thyroid and cricoid. But most important to know is the epiglottis, the arytenoid cartilages. What are the arytenoid cartilages? They are bands of cartilage attached to muscles, and they control the airflow to the trachea. So the arytenoid cartilages, hopefully you watched, there was another video I sent, it was a chocolate lab, and they showed in the video, they showed the anatomy, a nice picture, explained how it opens and closes. But the vocal folds are attached to the arytenoid cartilages, which are attached to muscles. Those muscles, when the animal inhales, open the curtains, okay? Controls the airflow to the trachea. When the animal is eating and drinking, those should close, the epiglottis closes. Now, when I talked about laryngeal paralysis, what's happening is those arytenoid cartilages, the muscles or the nerves that are controlling that are weakened, usually genetic, okay? Usually it's idiopathic, meaning we don't have a reason. It's just, but it happens in old Labradors. I see it in a lot of Labradors. So what happens is they're like this instead of opening the curtains all the way. And then you get that roaring, very odd breathing when they come in. It's very loud, it's very distinct. And those dogs are hyperthermic because they can't pant efficiently. So most of the time when those dogs come in, they're very hot because they can't expel and cool the air like a normal dog. So two functions of the larynx, and then the epiglottis is the most rostral of those cartilages. Okay, so this is all cartilage here. Okay, these are all cartilages. This opens when they're breathing, closes when they're eating. The vocal folds make the sound, and these are the functions of the larynx. Protect the airway, produce the voice, prevent inhalation of foreign matter. And again, I use the analogy that I'm a bad person that likes to talk when I'm eating. And if you're talking, you have to have your airway open to produce a sound. So that means your airway is open. So if you're swallowing food and talking and you get something down the wrong pipe, it's because while you're talking, your larynx is open, and that allows food to get down into the trachea. So, and stop me if you have questions. I'm just trying to kind of go through this line by line. The split number 15 in the trachea is called the bifurcation. So that's an important landmark that we talked about. It's right here. That's where it subdivides into the right and left sides of the lungs. And that's where we stop our endotracheal tube. We don't want to put it for anesthesia. We don't want to push it too far and it goes down one side or the other, because then one side is not getting anesthesia or oxygen. So that's the importance of that part. The trachea for 16 is not complete rings. They are C-shaped cartilages, okay? They are held together with some smooth muscle. So understand what controls smooth muscle. Do I control smooth muscle? Do I go, hey, trachea, can you dilate right now? And the trachea goes, okay, I'll dilate. And I go, thanks, trachea. What controls it? What controls smooth muscle? The autonomic nervous system. So basically, remember, in fight and flight, you're probably going to need more air. So that band, it's kind of like a cinching. Okay, here's a C shape. If it relaxes, it opens. So you need more air. When you get into parasympathetic, after you calm down and you're in rest and restore, that muscle goes back to normal diameter. So during fight and flight, that's going to relax. Now, the bronchioles in your lungs have the same band. So your bronchioles in your lungs can actually dilate. The other thing is people with asthma take a drug called a bronchodilator that will actually dilate those muscles and allow air to come in. Okay. For 20, how many lung lobes does the dog have? 7. And the horse, let me go back. Am I missing something here? Okay. Sorry, thought I skipped around. Yes, I did. I did skip around. Sorry. 17, the smallest bronchi, or the bronchus, is a bronchiole. Just like it goes artery, arterial, bronchi, bronchiole. So a bronchus is larger. People use bronchus, bronchi is about the same, but it's going to branch. Just like you have the trunk to a tree is your trachea. You've got these big tree branches that split, and then by the time you get to the end of the branches where the leaves are, you've got these tiny little branches. So the little branches are the bronchioles. Number 17 is bronchiole. For Sean, when you asked that question, number 17 is bronchiole. Okay. And then what is the difference between an alveolar sac and an alveolus? And here's the slide talking about the autonomic nervous system and bronchodilation versus bronchoconstriction. The air sacs are the alveoli. So they're these open, think about them like little bubbles, little balloons, something that holds air. Okay, so they are open air sacs. An alveolus is one. An alveolar sac is a group, remember, like a bag of grapes. If you buy a bag of grapes, that's the sack of grapes, or the alveolar sac. If you pull out one grape, that's an alveolus. Okay, so at the end of every alveolar duct, so it goes bronchiole, and then it goes to an alveolar duct, then it goes to an alveolar sac, and then that oxygen goes to each individual alveolus. I didn't ask a specific question about this, but you do need to know what surfactant is. Surfactant is a fluid contained within the alveolus, and it helps it stay inflated. Believe it or not, you don't think about fluid in your airways, and it's not a lot. It's just a very thin coating. Remember I said if you were going to coat, you buy one of those balloons, they squirt the fluid in the balloon, and sometimes people don't know what the hell I'm talking about. But if you go to Party City, of course, it's a little extra charge, but it does work. They squirt a little fluid, they blow up the balloon, and it helps the balloon stay inflated. So the job of the surfactant is to help the airway stay inflated, and it helps diffusion of oxygen and CO2. Okay, that's the only fluid that should be in the alveolus, is this surfactant. And then for 19, I already answered this. What controls bronchoconstriction and bronchodilation? The autonomic nervous system. 20, the canine has 7 lung lobes. The cat has 7 lung lobes. The horse has 5 lung lobes. 21, I've already explained pulmonary circulation. That was that extra handout I gave you. 4 components of the thoracic cavity. Okay, I already talked about the lungs. We've already talked about pulmonary circulation. My pet peeve on this question is everybody tells me the ribs, okay? Now, there is a component of the ribs that face the thorax, but I said, think of a room. If I said, what's in your bedroom? Would you tell me a wall? You'd probably say a dresser, a bed, a lamp, my clothes, a chair. You're not just going to tell me there's a wall and a door. Well, yeah, that's your room. It's usually a wall and a door. What's inside your room? What are the pieces inside your room? Think of that like the thorax is a room. I know there's walls. I know there's ribs and intercostals and a diaphragm. That's my room. Those are my walls. What's inside? There's only about 5 million things you could say right here. Not exactly 5 million, but there's a few. Lungs, and I'm always kind of surprised. I will say, list what's inside this cavity. Like there were people that didn't tell me the heart. I'm teaching the cardiovascular system. The heart's probably one thing. I'm teaching the respiratory system. The lungs are probably one thing. So lungs, the heart, blood vessels, the esophagus, trachea, lymphatics, esophagus, lymph nodes. So does everybody understand what I'm looking for there? Hopefully you do. The purpose of the diaphragm. The purpose of the diaphragm is not just a wall. Now remember, the mediastinum is this space right here. Most of your thorax is lungs. The majority of your thorax is lungs. You've got this space right here that contains most of the very important structures: blood vessels, nerves, lymphatics, heart, and such. But the diaphragm is actually a respiratory muscle. It is a sheet, it is skeletal muscle. It is under conscious control. Any skeletal muscle I have control over. You can hold your breath. We've talked about this. But remember, the brain can overtake and obviously trigger a breath. So you only have a certain time frame of conscious control of the diaphragm. But it is a skeletal muscle. It is a respiratory muscle. It does form a border, okay? Remember, I want you to know the muscles of respiration. So that is the diaphragm, external and internal intercostals, and the abdominal muscles. Those are the muscles of respiration. Now, remember, the pressure of the thorax is negative intrathoracic pressure. That's the space. So if your room, since I'm using the bedroom for some reason, if your room is an analogy and you sucked all the air out of it, it would, yes, this is, thank you, Sean. It's the space outside the lungs, the thoracic cavity, and we're talking about the pressure around the lungs is negative. And so what happens is there's a little bit of a vacuum in there. So what happens is your ribs contract, your intercostals, your externals contract, pull the ribs out, diaphragm flattens, and remember, your lungs touch the diaphragm. It stretches. By nature, your lungs are sitting here inside, and they're just kind of chilling. And then all of a sudden, the chest gets bigger, and they go, oh, I can stretch. And then the thorax closes, and then it goes, oh, okay. And then they can expand. They are passive sponges of air that if they expand, they draw air into them. That's how inhalation occurs. Now, the other thing that happens is the thorax is going in and out, in and out. There is a vessel going through the thorax. It's going to help blood come back in because it's acting like a pump every time they inhale and exhale. So there's a thoracic pump. And I don't know if I've talked about this with you guys because you guys were just doing physicals. There's dogs have what's called a sinus arrhythmia. If you ever listen to your dog, Bo has it to some degree. When they inhale, their heart rate speeds up. When they exhale, their heart rate slows down. It's usually seen in more athletic dogs, more in shape dogs. It is a normal arrhythmia. We call it an arrhythmia because it doesn't follow a normal rhythm. You should be able to set a beat to a dog's heart rate. But if it speeds up and then slows down and then speeds up and slows down, that's That's not really like the beat of a song, okay? As long as it follows respiration, it is a normal condition. I call it a regular irregularity. It's an irregularity that happens on a regular basis. Now, the reason that's happening is the physiology of the thorax. When the lungs, the heart is between the lungs. When an animal inhales, it puts pressure on the heart and it puts pressure on the vessels. The heart's natural reaction is to speed up. When the animal exhales, the pressure is relieved from the heart and the vessels, and the heart goes, oh, okay, I can beat. And then they inhale and they go, oh, wait a minute. And then, oh, I can beat again. So it's the relationship to thoracic pressure that causes that sinus arrhythmia. That is where that's coming from. And again, as long as you follow the respiratory pattern and it does that, it's normal. Okay. Just wanted to bring that up since we were talking about pressure. So the lungs inflate. I just explained how they inflate. And I want you to be able to explain that process to me. How negative thoracic pressure allows the lungs to passively inflate. They, right here, lungs follow enlargement passively. They do not move themselves. They are not muscular. Okay. And then I told you the inspiratory muscles, and then these are the expiratory muscles. When the thorax gets smaller, the lungs get pushed, the animal exhales. The volumes that you need to know. Now, in the email yesterday, hopefully you read it. If there's people on here that have not read their email, well, A, shame on you. But B, I've put these values in your email. So you need to know the volume for tidal volume, how to calculate it, minute volume, not residual volume. Tidal volume is the amount of air moved in one breath. Inhale to exhale, and you have to put volume. If you do not put mils, MLS, which is milliliters, that is how we measure air volume, you will get marked partial. I'll take partial off, points off. That's what I'm trying to say. You have to put milliliters. So my example yesterday, I'm not going to retype it because I sent you the email yesterday, was a 40-pound dog. It's 5 mils per pound. Tidal volume is 5 mils for every pound of body weight. So I used a 40-pound dog. I said 5 mils times 40 is 200 mils. That dog has a tidal volume of 200 mils. Now, minute volume is the amount of air moved in 1 minute's time. It is tidal volume times respiratory rate. So you have to get a respiratory rate. Yesterday, now our dog's tidal volume was 200 mils, and the dog is breathing 10 times a minute. 200 mils times 10 breaths a minute gives me a minute volume of 2,000 mils. So in 1 minute, that dog is moving 2,000 mils of air. Residual is the leftover in the lungs because they never completely inhale, exhale. There's always a little bit of air left in the lungs so they don't collapse. And that's our residual or leftover. You don't have to know that. So you do have to know the tidal volume. You have to know the formulas. And I will give you a weight of an animal and I will give you a respiratory rate. Okay? Respiratory center is, now also that I want you to know for the test, you're going to have to be able to tell me if I give you a spot in the capillary or in the alveolus during inhalation or exhalation, what is higher? Blood coming to the alveolus. This is a pulmonary, I'm going to point over here, okay? Right over here was a pulmonary arterial, branches to a pulmonary capillary. The pulmonary capillary coming to the lungs is low in oxygen, high in CO2. This is why it's blue. As soon as it passes by, this is when it's going to diffuse, remember? And remember, during inhalation, this is high in oxygen and low in CO2. They trade now after the blood in the pulmonary capillary here is high in oxygen, low in CO2. What's going to go here? Pulmonary venule. Then it's going to go pulmonary vein. Then it's going to go to the left atrium. You see where I'm going? So I want you to be able to tell me the blood in the capillary or the alveolus at the point of either inhalation or exhalation, what is higher, what is lower, okay? Respiratory center, you should have told me when I told you how this diffuses. We've already kind of talked, this is all, a lot of that I just talked about is in that separate handout with pulmonary circulation. So that kind of relates to this and the diffusion. The brainstem, specifically the medulla oblongata, which is in the brainstem, which is at the base of the brain, heading into the spinal cord, that's where the base brainstem is, and that is the respiratory center. If you hold your breath for too long, eventually the respiratory center is going to trigger a breath because CO2 is climbing because you're not breathing, and it's going to want to regulate that CO2. Mechanical and chemical. Mechanical is stretch receptors. Mechanical controlled breathing is sensing how much the lungs are expanding or contracting. So those are stretch receptors in the lungs. They trigger a breath when the lungs get too big or when the lungs get too small. Chemical control of breathing is monitoring CO2, pH, and oxygen. So chemical control means they're monitoring chemicals in the blood, okay? Mechanical is something's moving or stretching. Chemical control is measuring CO2, pH, and oxygen. So remember the relationship. CO2 goes up, pH goes down, CO2 goes down, pH goes up. Inversely proportional, okay? And remember, in extreme situations, I also put in the notes yesterday, oxygen normal is greater than 95%. So when you get that little test on your finger with the red light, and we put it on a dog's tongue, sometimes we put it on their ear, on a lip. It's the same in people as it is in the dog. It should, your oxygen concentration, if you get that test, should be 95% or higher. Normally, most living people walking around are about 98% and it doesn't go higher than 100%. You can't go over 100%, okay? So that's max saturation. If the body detects that that oxygen is dropping, it's obviously going to try to get you to breathe more to pull in more oxygen. If it still is not able to attain oxygen, you can get to a point where the nerves fire so much that everything just kind of like gives up. And then we get into severe hypoxia where the breathing can stop completely. Okay. Does anybody have any questions about the study guide or anything else they want to go over? All right.
I do.
Go ahead.
It's an easy question. I got 2 out of the 3. You were talking about the muscles of respiration, and it's the diaphragm, the intercostals, and what else?
The abdominal muscles.
Thank you.
Yep.
That was it. See how easy that was?
I love that. That's great. I love the easy questions. Anyone else have another question that they didn't understand or another concept they want to go over? I've sent you several videos. You have all my lectures. You have the links to the videos. Oh, let me mention one thing briefly that I don't think I talked about. When I've talked about effusions before, I've talked about pericardial effusion. Pleural effusion is a condition where fluid is around the lungs. If you get fluid in your thoracic space, which is the pleura, is the lining, that means there's fluid outside the lungs, which if you get enough fluid in the thoracic cavity, the animal isn't going to be able to breathe. Usually animals with pleural effusion come in, have a very hard time breathing. Sometimes they're a little cyanotic, which is when they get the bluish purple color. And we can put a needle in the chest and we can pull that fluid off. Now, if an animal comes in and has pulmonary edema, remember, edema is fluid in tissues where it's trapped in the lining of tissues. If a dog has pulmonary edema, sometimes when they go into cardiac failure or they have, advanced cardiomyopathy, they're not pumping blood efficiently. Fluid normally backs up into the lungs, so they sound crackly. Those dogs sometimes have a hard time breathing. But the problem is I can't put a needle. It's like put a needle in your kitchen sponge and suck out all the water. Is that going to work? I mean, it's spread throughout the sponge. So what we have to do is use drugs called diuretics. And what they do is they will pull fluid like Lasix. Lasix is a common diuretic. So if animals have edemas, fluid potentially trapped if they have swollen limbs or in the lungs, then sometimes we will go to these what are called diuretics. It will force the fluid to, it'll increase the fluid flow to the kidney and hopefully draw the fluid out of the tissues. Because normally I always warn owners, if your dog's on Lasix, they're probably going to want to drink more, but they're going to have to pee all the time because we're trying to force that fluid from the tissues. But I just wanted you to realize the difference between fluid outside the lungs because it's a space. Remember I said effusion is in a cavity or a space, where edema is a fluid inside a tissue. I can suck out pleural effusion with a needle and suck that fluid out of the chest, but if it's in the lungs or in a leg or in tissues, you have to use usually drugs or pharmacological agents to act as a diuretic to pull that fluid out of the tissue. Okay, that's the last thing I want to say. I forgot that I wanted to mention that. Any questions? I will email you. You have all the videos I've sent. I've sent you extra things. You have the extra handouts. I sent you an extra handout with some pictures. The test will probably be open. I will send that in the email. I think I'm going to do like 8 a.m. to maybe 2 p.m. I think is what I set. So you'll have, just make sure you're not missing another class for my test. You will only have 75 minutes. I've decreased the time on my tests. So you'll only, it's still, or maybe, yeah, I mean, it's still over an hour. That's an hour and 15 minutes, which should be plenty of time to take the test. So you would have to start it no later than like 12:45. I'll put that in the email. If you need me, I should be able to check my email. Like I said, we'll be traveling today. So if I don't get back to you right away, that's probably why, but I should be able to check my email while we're driving if you have questions. All righty. All right. If you have no questions, you're free to go and just, I will see you tomorrow. Or I won't see you tomorrow, but you'll see a test tomorrow. Thank you. I appreciate that. Yes. Kind of a long drive going out 70 west. They're outside of Springfield, Illinois. So, yes, have fun with the puppy. Don't worry. I'm sure though a picture will get posted, but you will get to see him live on Thursday. He's probably going to be in my lap quite a bit while I'm lecturing to keep him quiet. All right. Well, you guys have a good one, and I will see you, or test will be tomorrow.